A ton has been written of late about the disruptors coming into the healthcare industry from other industries. Notably, lately, Warren Buffett, Jeff Bezos, and Jamie Dimon are going to do something bigger than shaving a few percentage points off healthcare costs for their million-plus employees. The fact is, the combined purchasing power and will of Berkshire Hathaway, Amazon, and JP Morgan just might make a dent in their runaway healthcare spending. But frankly, healthcare has been benefiting from disruptors bringing their skill sets honed in other industries since one of our founding fathers, a printer by the name of Benjamin Franklin, invented the first flexible catheter to help relieve his brother's bladder stones. And a ventriloquist, Paul Winchell, invented and patented the first artificial heart, assumably without the help of his puppet, Jerry Mahoney. Hi, I'm Amy Grant, president of the ABL organization, and if we fast forward to the current day, we don't need to look any further than a large number of ABL members who've entered healthcare from other industries, including one of our founding fathers, Bob Finari. As a kid, Bob loved cars, and he was educated to be a mechanical engineer and headed for the auto industry before he started applying his skills in production control at Baxter. There he rose to being the president of a very large division called Pharmaceal, and after that, he took those skills over as the CEO of Syncor. After that exit, he started his own auto collection. Today, Bob chairs Next Stage, whose System 1 allows patients to dialyze at home. In our Silicon Valley Roundtable, several of our members entered healthcare from totally different industries, like Dean Hovey. Dean is the CEO of Comprendo, who, as a general engineer and product designer, co-founded what became IDEO and worked with Steve Jobs to develop Apple's first mouse. After founding and leading several more tech companies, Dean's brought his consumer UX savvy into creating mobile products that merge medicine, motivation, and mind to activate patient and provider engagement in organizations like New York Presbyterian and, more locally, El Camino Hospital, the hospital of Silicon Valley. Dirk Schaffler is another Silicon Valley member who began his career in electronics and mechanics, working for several large German automotive suppliers before segueing into Bayer's material science division in both Germany and the US. After his successful exit from a US-based material science company, Bayer recognized that he had crossover talents and named him to head digital innovation at Bayer's Life Science iHub. There, he and his team are converging remote patient monitoring and big data visualization to create new medical innovations. Originally, John Lee, another member of the Valley, put his PhD in chemical engineering to use in advanced micro devices and several other tech companies before launching VivaLink. The company's first commercial success is Fever Scout. It's a soft, wearable thermometer, looks like a Band-Aid, but a pretty one, that measures body temperature on the sick child or baby or post-surgical patient and sends it wirelessly to a mobile device on an app, either in the home or at hospitals to monitor. And Sean Tan, after earning his degrees in aerospace and biomechanical engineering, spent his career largely in the telecom industry with companies like Nortel Networks, UT Starcom, and Brocade, before leveraging his Wi-Fi expertise as the CEO of AI Care. This VC-backed artificial intelligence company is blending machine learning with IoT-enabled sensor technology to enable intelligent senior living in skilled nursing, assisted living, and memory care facilities. Looking back, several of ABL Healthcare's founding members were med-device CEOs like Bob Finari, who transitioned from our founding technology network, SoCal10, and originally belonged to one of our tech roundtables. Given that was in 1989, we've had the pleasure of helping disruptors grow successful healthcare businesses for nearly 30 years. To learn more about ABL's other disruptive members and trends that are also disruptive, check out our latest ABL Healthcare online. And remember, only the adaptive get to stay business leaders at all.